Welcome back to the Papa Meat channel. How you doing? How you doing? Come on in and sit on down because today we're talking about plastic surgery. Now, plastic surgery is pretty common, right? Especially in today's society. The rise of social media, making people want to be a little better version of themselves. Hell, sometimes it's not even for aesthetics. It's just about dermatology stuff. Maybe you got, who knows, you're a burn victim. You want your face to be normal again. These could be fairly normal procedures. But I do think that with beauty apps coming out, people want to look different, feel better. It's in people's rights to want to be able to do so. But sometimes it can go a step too far. At least in my opinion. I don't want to be judgy, but these are some extreme cases. So today we're going to look into the horrible events of plastic surgery as we know it. So let's get into it. Today's video is sponsored by Fume. If you have an unhealthy addiction, then maybe it's time to try Fume. Once you form a bad habit, it's hard to take a break. And usually quitting cold turkey is the absolute worst thing someone could do. Let Fume fill the void in a natural, guilt-free way. You can still get your fix, just with healthier options. Fume's innovative, award-winning device is a sleek, lightweight, and can help you kick your habit. Fume is completely natural and replaces vapor with flavored air. Instead of harmful chemicals, users can enjoy Fume's refreshing flavors like crisp mint, sparkling grapefruit, orange vanilla, and raspberry lemon. Right away, you'll find out that Fume device is easy to use and tastes surprisingly fresh. For many people, using the Fume device can also be a relaxing way to deal with anxiety and de-stress. Stopping is something we all put off because it's hard. But switching to Fume is easy, enjoyable, and even fun. Fume has served over 150,000 customers and has thousands of success stories. And there's no reason that can't be you! Join Fume in accelerating humanity's breakup from destructive habits by picking up the Journey Pack today. Head to tryfume.com/papameat or scan the QR code and use code PAPAMEAT to get 10% off when you get the Journey Pack today. The Fume Solano launched last November. And you can upgrade your Journey Pack to the Solano to enjoy the premium walnut barrel and onyx black coated mouthpiece that has a smoother finish and still get 10% off. That's tryfum.com and use code PAPAMEAT to save an additional 10% off your order today. Thank you to Fume for sponsoring this video, and back to the video. Plastic surgery or cosmetic surgery is surgery done for the specific purpose to improve the appearance through reconstruction of tissue due to defect, illness, or trauma. Or maybe you just have a lot of money and you want to change it up. I'm gonna be a new me. Contrary to its name, plastic surgery or cosmetic surgery has no correlation with plastic at all. Plastic surgery gets its name from the artificial nature of the procedure, but from the Greek word plastikos, which means mold or to give form. Those Greeks always had something to say, didn't they? It's actually plastikos, to give form. You know how it is. More German than Greek, doesn't matter. When you think of plastic surgery, you probably think of it as a modern day procedure. But in fact, humans have been documented performing non-medically necessary surgery since as early as 2000 BC. Or, if we have some liberals in chat, BCE. Calm down in the comment section, guys. I hear you. We say BC on this channel. Before Christ. I don't want anybody talking about before Common Era, dude. It's before Christ. Most of these were to treat facial and skin injuries. An extreme example would be people in India having their nose cut off as punishment. Is that plastic surgery or is that just punishment? No, that's just cutting off a man's nose. Technically, it's a cosmetic surgery, just not one you voluntarily have. Boom, boom. In 800 BC, India has a documentation on performing skin grafts for injuries. This is where you take the skin from one part of your body and transplant it to another area. It's like sometimes you have to take the skin from your ass to put it on your face. You don't see your ass all the time, but you see your face all the time, so you take the skin from your ass, you put it on your face. But then you don't want to tell anybody that you put ass skin on your face, because people will be like, ooh. Some of the first true plastic surgeries documented were for a cleft palate, going as far back as 390 BC in China, when the first successful surgery for closing a cleft lip was performed and documented. Even with documented procedures, they were rare due to the fact that anesthesia had yet to be invented, which is brutal. I would be like, keep the cleft palate. I don't care. I'm not going through that procedure without, to not be put under and you have to feel everything. Holy shit. Your body probably goes into shock, but I couldn't power through. I'm getting ready to go to the dentist and I can barely even stomach the idea of that. Like, holy fuck. In 1460, the first medical texts for plastic surgery procedures were created for the nose job. It wasn't until the 1700s that the Eastern techniques were brought to Europe to develop this specialty. It wasn't until 1927 that Johns Hopkins Hospital created a formal training program for plastic surgeons. I bet you anything that was in California. Those fake bitches out there, am I right? John Hopkins was like, how can we be even less real? I bet you John Hopkins was a very judgmental person. Okay, fatty, well, your chin could be a lot better. The person's like,
Really?
And this is also Great Depression era, too. John Hopkins being like, you got a lot of uggos walking around the streets. A lot of poor bitches walking around looking extreme. extremely ugly. Early uses of plastic surgery were primarily for people suffering from birth defects, physical trauma, cancers, infections, and growths. It wasn't exceedingly uncommon to undergo procedures for the singular purpose of aesthetics until the invention of antibiotics and best hygiene practices, because the risk of death from infection was prohibitively high. Basically, people were saying, I mean, you could get plastic surgery, but at the same time, you could probably fucking die. If anything, it was, I mean, like, it's not like it's not respectful now. I'm gonna go on record and be like, I don't give a fuck what you do. As long as it's not affecting someone else negatively, who gives a shit? But back then, I feel like there was a lot more respect for it, because someone's just like, that nose looks great, and you could have fucking died for that nose. Are you kidding me? Good on you, Todd. His nose is like paper thin. Thank you. Doesn't he look great? And everyone's just like, yeah. There's a lot of reasons why people do plastic surgery, okay? I mean, some people like to blend in with society, right? With their environments. Plastic surgery could help people with physical abnormalities to better blend with the society that they live in. Sure! Nobody likes being the odd one out. No one likes being the ugly duckling. Some people do. Those people are called freaks. I didn't say it, you did. Gender-affirming care like breast implants, facial feminization surgery, removal or addition of various sex organs, genitalia, etc. Pretty much the gender-affirming care for plastic surgery. Some people want bigger titties. Some people want smaller titties. Some people don't want a cock anymore. Some people want a cock. Sometimes people just want to feel comfortable in their own skin. And sometimes it's quality of life, like the cleft lip surgery, which cleft lips often leave babies unable to nurse, and as they get older, they have difficulties eating. Having a cleft lip can allow bacteria access to sinuses that may cause ear infections and hearing loss. Some people are just like, hey, my fucking lip's all fucked up. I need to get it put down, which actually this baby here, that's very impressive. That's insane that we can even do that. How the fuck did we even get to this point? You know what I mean? Back in the day, the Greeks would look at this and they'd be like, ooh, and they just toss it off a cliff. Oh, lips messed up. You get to have sex though, and you get to try again, and the family's like, okay, and that's how it was. Sometimes people want breast reductions because it hurts their fucking back. So sure, I know people are like, it's a slap in God's face having a breast reduction. My aunt had a breast reduction because those shits were insane. All right, that bitch could barely go up a flight of steps because her back was so hurt. Now she's got tiny titties, big confidence, and one hell of a wardrobe. Yo, my aunt's on top of the game because of these tiny titties, dude. Tiny titties rise up. I can't even lift my hand up because I got ginormous man breast. Yo, when the fuck can I get my breast reduced? Actually, if anything, if I got a breast reduction right now, it would look so weird with my giant slug body having like a flat chest. Hello, everything. This is fine, but everything else is just collapsing. I'm collapsing under my own girth. You have people who need it for those reasons, but sometimes it is purely cosmetic. Some people are just like, I don't like the way I look, which goes into a big point of plastic surgery, which is body dysmorphia. Which body dysmorphia is growing rampant these days, and people are desperate to change themselves at any cost. You know, body dysmorphia is a huge thing. If you don't even perceive yourself the way that other people perceive you, you are not comfortable in your own skin, but also it goes to such excessive extents. You know, body dysmorphia of people who are probably like super fucking fat, but can't process that they're that large. Same with like bodybuilders who feel like they're tiny, even though they're gigantic and they look like the fucking Hulk. One of the most common plastic surgeries is, of course, the breast implant. All right, boys, calm down. We get it. Hey, calm down. There are over 300,000 surgeries performed each year just in the United States alone. That's a lot of bigger titties. I didn't know that. Kind of hard to think that titties could be universally so small to where people feel like they have to make them bigger. You know what I bet it is? I bet a lot of the titties are fine and people are just being greedy. I'm not body shaming anybody. I just want to say, if you have fine titties, leave the fine titties alone, dude. Everybody likes a nice titty. No one likes the titties where it looks like a handmade Indian carved bowl just like tucked under your chest. And they're like two separate and you have that giant flat divide. It's like looking at the Salt Lake in Utah. Beautiful mountains on each side, but just a barren flat oasis in between. Tragic. The first breast augmentation was done in 1895 by Dr. Vincent Sindri, also known as the happiest doctor on planet Earth, where he implanted a lipoma, a fatty growth, into a 41-year-old singer after she had a partial mastectomy, which is you had to get some of your titties ice cream scooped out and you throw it away the cancer. The breast was smaller and firmer than the opposite, but nonetheless, she was in perfect health. So one titty was a little softer, one was a little more firm. If anything, I bet the guy was just like, this is dealer's choice. All the other guys, he's like, what, both your wife's tits feel the same? It's like almost like getting to flip this. It's like when you like your hot pillow sometimes, but then you can flip it over and it's the cool side. Over the years, breast implants were made out of many materials, such as glass balls, ivory, rubber, cartilage, wool, gutta percha, polyethylene chips, and sponges. If my wife came home and she's like, I got breast implants, and then she's like, I got a glass ball breast implant, I couldn't help but feel like I'd be like, that's sick. Every time she tripped, I'd be like, there goes the glass. That cannot be safe. You fucking fall down and it's like an ornament on a tree just cracked. And she's like, on the ground. In 1899, experimentation with wax and other implants injections killed many women. Took a bit of a dark turn. In 1945, it was reported that Japanese prostitutes used paraffin and goat's milk injections to help shape their breast. That'd be crazy, dude. Get a Japanese prostitute in 1945 and you're just like,
Let me suck your titties a little bit.
you just taste nothing but goat's milk. Yo, why the fuck does this taste like goat's milk? She's like, don't worry about it. You're being insane. It wasn't until 1961 when the first silicone breast implants emerged. Originally, they used to be injected directly into the breasts of the women, which would result in silicone granuloma and hardening of the breast. Both of these problems would require a mastectomy for treatment. I think I knew somebody on my street growing up that had one of those original ones where they had right into the tit, because every time you gave her a hug, it was like hugging like a rock creature. I remember as a kid, I asked my mom, I'm like, does it hurt? My mom was like, probably. Which, looking back on it, I'm like,
All right, you bitch. Jesus.
it was tested on one dog before being approved to use on a human woman. What? The dog just, he's just sitting there, and all of a sudden, they go to one of its tits, and they're just like, you think they injected it near the dog's nipple? I'm imagining a perfect human woman's breast on a dog now, near their stomach.
The funny thing is, I like waited like 7 days, and I'm like, all right.
Yeah, they waited 7 days. They waited 7 days, and like, all right, the dog's doing good. All right, put it down. And
Let's start putting these into women's tits.
Frank Garreau and Thomas Cronin inserted it into a dog named Esmeralda. Perfect dog name for this. It almost would have been if the dog's name was like Diamond or Rose. Oh, man. They only waited a few weeks before declaring the implants harmless, even though the dog chewed at their stitches until it had to be removed. Dog's like, get it out! Get it out of me! And they're like, that's probably normal. I doubt the women are going to do that. All right, just ship it out. Silicone breast implants over time were found to cause cancer and make it difficult to perform mammograms, which is a procedure to check breasts for lumps, which actually I'm pretty sure I saw what a mammogram was, and it's like they literally, you like put your tit onto a fucking device and like literally pile drives the tit down. You ever see those videos where it's like the thing goes down and it presses like a bunch of Skittles and they shoot out? They put their fucking tit, like put it up on the hydraulic press, and he has like a button, and they're like, okay. But it's like going down. I was like, holy shit. Imagine you had to do that with your balls.
Nope.
All we have is a doctor that holds our balls in our hand, and he like does this, and he's like, you been feeling weird lately?
They got also the finger.
I've never had a finger inside me yet.
5 more years.
Are you saying like it's a Groundhog's Day or something? Puts it inside me, he's like, uh-oh, 8 more weeks of winter. I see my own shadow in the corner. Japanese women who were entered into sex slavery for American soldiers were injected with stolen silicone, which eventually caused gangrene, silicone rot, and even death. Man, that's fucked, dude. If you're gonna hand-me-down silicone, dude, holy shit. Ads for the injections claim that no harmful effects have been reported. In the days of injections and the first implants, it was common for employers to request women to get surgeries. Holy shit. You know, your tits are looking pretty small. Just like 8 a.m. wasted on scotch. We're gonna make your tits real big. Huge. And they're just like, I'm a librarian at this local school. He's like, perfect. People want to read all the time. Injections were banned in 1965 due to the unsafe nature of silicone implant. There we go, thank God. These days, breast implants have moved away from silicone gel where possible. The 3 most common modern methods are saline filled, not as natural feeling, too soft, but can retroactively filled more, and if they leak, they aren't likely to cause issues. Silicone gel filled, more natural feel, but can leak into the breast tissue and cause issues. And gummy bear, what the fuck? Thicker silicone breast implants, hard and a natural feeling, but gives a better appearance. Give me the gummy bears, dude. I don't give a fuck how they feel. How do they look, toots? If I'm going to my college reunion, I want to be like, I got my wife the gummy bears. They're not gonna touch them, you know what I mean? Hey, nothing wrong with window shopping. Breast implants, as we know them today, have size limits. The largest size sold commercially is 800cc in the US, meaning slightly less than a liter, or basically almost 2 pounds, 1.76 pounds. This is due to ethical concerns with larger breasts that could disfigure skin, stretch the pocket they place them in, and have higher chance of rejection. As it's known though, many women have sought out larger breasts that have met unfortunate circumstances in their way. So let's talk about some women who push the extremes to breast implants. Susan Sykes, aka Busty Heart. I did not make that up. That's what it was online. She was a 63-year-old stripper who had 34 breast implants, earned enough money to buy a nightclub, a strip club, and a literal island. The sagging breast tissue from the weight distorted her stomach until she needs a tummy tuck, but her breasts are too large to effectively do the surgery. Is this the botch thing? Is this her here? She crushed a can with her breast. All right, she's bringing out a fucking watermelon now. The silicone in her tits are so hard that she's able to destroy a fucking watermelon. Look at these guys. Oh my god. Is this the goddess Aphrodite in front of me, crushing these watermelons with her tit? Next up, we have Brian Mammaries. Like mammary glands, get it? Engaging in a bet with a friend, he got $100,000 if he'd get a pair of breast implants. That's awesome. That's a big bet. He gambled with plastic surgery buddy and won $5,000, which he exchanged for his tits. Apparently, every year he keeps these breast implants in, he gets $10,000. That is not worth it. Those are so weird, which I guess if you're like married, who gives a shit? But like, even just feeling them, I don't know. I have my own pair of tits and I don't want them, you know? And then of course there's the 32 triple D breast implant exploding. A patient went in complaining of breast pain after getting very large implants. Both implants ruptured and leaked silicone into her lymph nodes. Oh man. Holy shit, her tits literally did explode. That's crazy. I just feel like there's no way we can show any of this. And last up, to really indicate some of the psychological and some of the damage that can be done, we're gonna talk about Sheila Hershey. She spent $320,000 trying to transform herself into Dolly Parton. She's looking to eventually have 24 liters of saline in each implant for a size of 000. Have you ever heard of that? Me neither. Her skin will not stretch that much, and the skin between her breasts will eventually distend, creating a uniboob, as with many large-breasted implants. Awesome. I don't care what anybody says. Awesome. She seeks to earn the title of world's biggest boobs. And in 2005, an infection after liposuction and her rib removal nearly killed her. One of 2 near-fatal infections. And here's a little image of all the procedures she's done. She's had 38 breast surgeries, 28 liposuctions, 5 no surgeries, 190 cc's of butt implants, 2 floating ribs removed, 2 tummy tucks, eyebrow lift, countless Botox and fillers, breast surgery for triple O cup boobs, 2 ribs removed, 2 more ribs removed, pending. And lastly, the 360 liposuction and tummy tuck and fat transfer to hips, and that is also pending. What I say to Sheila is good luck, God bless. You are an anomaly. You are a shooting star. That's meant to be a compliment, not like a shooting star is like a dying star. That's not what I... Okay. There's also people who get addicted to these highs and can't stop getting the procedures. Like Mary Magdalene, who was left with an alien uniboob earlier this year after one of her size 38J breast implants exploded in her chest. She has since upgraded to a much larger 1000cc implants with silicone expanders installed so she can fill them up at home herself. That's awesome. Mary has stated that she, quote, has been trapped in a never-ending cycle of plastic surgery, and that, quote, it's not a fun little adventure anymore. It's just draining in every possible way. That's extremely sad. I don't know why the fuck we had to include that. The before picture is pretty insane. Beautiful woman, and the after picture is here we are now. It's a horrible case of body dysmorphia, you know? No way to go about it. And she almost had a fatal surgery so she could basically inflate her vagina so she would have the Guinness World Record for world's fattest. That feels like a fake thing. This almost feels like something that is in a comedy movie, but this is real life. Also, her buttocks started to rot after she had illegal butt injections, which she sealed with super glue, which leads us nicely into our next segment, butt stuff. First ever butt implant was in 1969 by Dr. R.J. Bartles, aka the stinkiest doctor in America, and at first used the same technique for breast implants, though this procedure did not become successful or popular considering breasts and butts look and feel different from one another. The only approved injectables for the butt are fat transfers, where fat is taken from one area of the body and relocated to a different area, as well as ass cheek implants, which are kind of made of the same material as breast implants, which, quote, a surgeon uses liposuction to remove fat from the abdomen, flanks, or back. The surgeon then uses a syringe to re-inject the fat back into reserved fat in the buttock, which leads us into Brazilian butt lifts, aka BBLs. Pretty sure that's a pretty common term. The Brazilian butt lifts have become the most deadly type of plastic surgery. That's actually crazy. I didn't know that. The procedure has increased over 800% over the last decade, from 7,382 surgeries in 2011 to 61,387 surgeries in 2021. Do we blame the Kardashians? I don't know. Let's just do it. Let's point fingers with no knowledge. Also, the statistic to remember here is that breast implant mortality rates are 1 in 72,000. I wouldn't roll the dice, I guess is what I'm saying. There were 25 BBL-related deaths in Florida alone between 2010 and 2022. The reason for its high fatality is because it's considered a blind procedure and the surgeon may damage large blood vessels in the buttocks. This can cause fat to travel from the heart and lungs, obstructing blood flow and causing immediate death. I like how the doctor's just like, Let's hope for the best, right? Let's get on in there. There's also an entire black market that uses unsafe injectables such as collagen injections, silicone injections, and dermal filler, which is used for small areas like the face. Let's talk about some of the notable deaths in some of the cases here for the BBLs, right? In 2019, Alicia Galaz and Libby Adam, a mother and daughter duo, were arrested for injecting a lethal dose of injectable silicone into a 26-year-old. Within just a few hours of the operation, the 26-year-old had passed. This is also not the first time someone has died because of Alicia Galaz. That demon! Okay. A year prior to another lady died on the same procedure, so these bitches are killing people left and right with these ass injections. Former Wild 'N Out star Jackie O died of complication at the age of 33 after a botched BBL. And Cardi B has revealed that at one point she did butt injections. Liquid silicone injections were given by some guy in a basement illegally. This is allegedly, but we like to believe this is real because Cardi B is a bit of a character. She sings WAP, right? She sings WAP. Need to make a new song called BBL. In a famous case from 2017, a woman by the name of O'Neal Ron Morris, aka the Toxic Tush Doctor, was sentenced to 10 years in jail after their patient, Shatarka Nubi, reportedly died from silicone migration in the body. For thousands of dollars, Morris, who was not licensed doctor, was illegally injecting a combination of Fix-A-Flat, cement, and caulking into patients' asses and sealed it with super glue. Give me the Netflix documentary immediately is what I say to that. This resulted in blackened flesh, necrosis, and even eventual death from the patient. Newby was receiving hip and butt injections from Morris between 2007 and 2010 and died 2 years later in 2012. The aunt of the deceased claimed she was with Shatarka many times during her injections, and Morris told her she got her silicone from Home Depot. Hey, there's a friend in the neighborhood, or whatever the fuck their slogan is. Morris denied the allegations, but decided to take a plea deal because she claimed that the widespread attention the case was getting was going to make her have an unfair trial. Oh, is this her? Oh, that's so sad. Oh, this is the doctor. Yeah, this is the tush doctor here. That's insane to think that there's just cement in her ass right there. Looks like fucking Leonardo DiCaprio's briefcase from Catch Me If You Can in her pants there. Good God. What a monster. Which it looks like, yeah, she was definitely doing her own supply. Next up, let's talk about facial procedures. Starting with injections. Different from silicone and injectable materials of the past, new injections are made of a variety of material that is readily absorbed into the body or dissolved with the addition of counteracting agent. And these injections can be used for things like making lips fuller, more plump, filling in fine lines and wrinkles, and raising cheekbones and defining jaw lines. Is that what mewing is? I'm pretty sure that's what mewing means. For your jaw. As people age, fat cells migrate and die off in certain parts of the face. And under the eyes and in the cheekbones and jawlines is the common area to correct this. Sometimes people get implants or fillers to solve this. You know, and I've known a lot of people who've gotten Botox or do these kind of things for certain health benefits or even to like fill in certain parts of like eyelids and stuff. It's a pretty common procedure. But let's talk about people who maybe took it a bit too far, which the first people up are extremely famous, the identical twins Igor and Krishka Bogdanov, which looking at their before and after images, it's you know. We have Jocelyn Windelstein, a Swiss socialite, has had multiple surgeries to appear more cat-like and youthful with implants. I found that with a lot of like face implant stuff or a lot of like facial plastic surgery, it seems like a lot of cases of extreme plastic surgery leads people to look very cat-like, much like that It's Always Sunny episode where his wife transforms into a cat. I don't know. In 2005, a woman went to the black market and instead of getting silicone filler, she was injected with a tire sealant and cement into her face. The fillers eventually hardened under the skin, causing large deformities in her face, and she was too embarrassed to file a police report. That is so sad. That is actually so fucking sad. Oh. How unfortunate. Brutal. And in 2015, she appeared on television show Botched and got her face reconstructed. Initially, the plastic surgeons deemed the surgery too dangerous, but eventually she underwent 4 surgeries over the course of 7 weeks. Okay, so this random person thought she was getting Juvederm, which is like a filler, but it's unbelievable. Looks like a spoiled tomato. How unfortunate, man. For real. Next up, we have Pennsylvania woman Kaylee Jones, who's 23-year-old, got fillers to make her lips fuller. An allergic reaction to the fillers caused swelling and made her lips blow up. And it's funny because she does look like that character from Monsters Incorporated. We're not going to keep making jokes, but that is what it looks like. There was even a woman who injected cooking oil into her skin. After doctors refused to give Hang Miyoki any more plastic surgeries, she resorted to injecting herself with cooking oil at home. Now the former model is permanently disfigured, but after 10 surgeries, this is what she looks like now. That's even, my God, there's some rough pumpkin aspects here, dude. Good God. Now, we're moving into Botox, which is the #1 minimally invasive cosmetic procedure. Between 4 to 5 million people get Botox per year, and over 85% of the procedures were done on women. Made from botulinum toxin, the same that causes food poisoning, it stops nerves from communicating with muscles, effectively paralyzing or reducing movement in that muscle group, which counteracts the effect of aging. And it was discovered in 1820, but in the 1950s, it was used to alleviate hyperactive muscles and small tics. But it wasn't until 1989 it was approved for use to treat cross eyes. 1997, the demand for Botox was so high that the US ran out, causing panic. 90s were a difficult time in the world, just as a large. Though it was in use for wrinkles since the early 90s, it was not approved for any cosmetic use until 2002 for the lines between your brows only. 2017 approved to treat forehead lines and crow's feet. Any other use besides forehead, crow's feet and 11s are considered off-label use, which of course that leads us into horror stories of Botox. I'm getting drained looking at this shit, dude. Good God. Botched Botox is a common occurrence due to the nature of injections given off-label and can create some strange appearances. Though there is no cure for botched Botox, the effects only last 3 to 6 months. Oh my God. Good fucking Lord. Looks like a character from James and the Giant Peach, doesn't it? God damn. Holy shit. What was wrong with the lips before? You know what I mean? You just want a little lip injection? Well, I guess it's probably she's like, oh, I just want a little bit, but then it's whatever. Brutal. But, you know, a big question is what could possibly go wrong with Botox, right? As you are paralyzing muscles, it's easy for needles they use to hit the wrong muscle as they're trying to work around the eyes. You can have a droopy eye or lose muscle functionality, which in 2001, a blogger, Whitney Buha, went in for her routine Botox. After she got her Botox shots, she felt it wasn't effective, so she went in and had more done. Ended up losing functionality temporarily in the wrong muscles, cytosis. And to compensate, her other eye muscles overworked and caused her eyes to bulge. Yo, she does look kind of inquisitive though. Put that bitch in a Sherlock Holmes outfit. She'd probably be pretty effective. TikTok user Megan Hare got Botox in her chin, which caused her face to draw up and lost movement in her jaw. That would actually fuck me up, not being able to like open your mouth. Crazy. I do like how the thing says get Botox in your chin, they said. WTF? A lot of surgeries are not driven by age or time factors, but a general dissatisfaction with the human body in general. Unrealistic standards from camera filters have exacerbated these issues as fast as medical advances can be made to create procedures. The drive for larger and larger lips has created a black market and unethical practices. Women are getting lips of such size and volume that they no longer look in the realm of aesthetically pleasing. In my opinion, we're dipping into cartoonish levels, I want to say. Acme is making lip fillers. That's a good joke. Damn fine joke. Acme, Warner Brothers, Looney Tunes, doesn't matter. Sometimes there's some surgical solutions, right? Like facelifts. In general, a facelift involves elevating the skin and tightening the tissues and muscles. Fat in the face and neck can be sculpted, removed, or moved. Facial skin is then re-draped over the newly repositioned contours of the face, and excess skin is removed, and the wound is stitched up and taped closed. That's how you do a fucking facelift. Not too hard, doctors. I don't need to go to school for 12 years to do that, dude. Get me on the black market facelift game. That's what I want to know. Let's talk about some crazy-ass doctors, starting off with Dr. Roxy. Last year in Ohio, a woman named Catherine Graw, aka Dr. Roxy on TikTok, lost her license to practice medicine as a cosmetic surgeon after multiple ethics violations. She became popular on TikTok for live streaming and making videos of her surgeries. Her non-surgical videos posted were extremely derogatory of the female body and set standards that necessitated having surgery for having breasts that a pin could sit under. Eventually started dancing and doing meme TikTok trends while operating. Her performance and videoing violated patients' privacy, and 3 patients of hers had to be hospitalized for intense medical care. One patient she live streamed suffered a perforated intestine after liposuction, where she published a video on her going ham on the woman's abdominal cavity with the suction probe. This is gonna be fucked. Oh, that is brutal. Holy shit. Surgeries were performed at a facility that was not licensed to do so, and her recovery house was not staffed by any medical professionals. This bitch looks like the devil already. You know, I bet she could throw a mean punch. I can tell you that right now. Like, lay your ass out in one big swing. On TikTok, we've been seeing a guy pop up a lot lately named Dr. Kim from South Korea, who has gained notoriety for his extreme facelifts. They've caused a little bit of controversy, I'll be honest, and if you look at the before and afters, it's very sad. Very sweet, innocent-looking people going in and they're just like, hi, I'm here for a procedure, and then they leave looking like the Phantom of the Opera. Like, I don't, like, it's pretty brutal. Normal lifts take skin from near the ears and at the temple hairlines. Dr. Kim does extreme lifts under the brows, at the forehead, and around the jawlines. It's caused an open brow lift. Dr. Yon has covered some of the extreme surgeries and the flaws in it, has drawn in skin so tightly it's caused ears to pucker and curl. If the hairline recedes, the scar becomes very noticeable. Which that's one thing I found too, yeah, is when you look at those, it's like it's pulled so much that the ears are like curling in like this. It's sad, man. And I just wanted to talk about one more. This is more body modification, but it's something that I'm still fascinated, and it's synthol. Synthol to me is one of the craziest things I've seen in terms of body modification for people who want to be bigger. I wanted to talk about Kirill Tiroshin. You've probably seen him on the internet somehow, but he is the Russian Popeye, as they say. But this guy, normal looking body, has been injecting synthol into his biceps. I mean, if you look at the skin, it's stretched. I know he's even gotten some facial reconstruction done, but he's definitely not the only guy who has gotten synthol. But to me, maybe we can do a full video on it. We can gauge people's interest, but synthol is so fascinating. I know that there's people who have gotten like shoulders near their neck, their arms, and it's just something that it will in time slowly kill them. And it's just, if anything that there's to take away from this video with plastic surgery is that there's nothing wrong with trying to fit into your own skin, right? There's nothing wrong with wanting to make sure that you feel comfortable as a human being. Never once in the video am I trying to say that it's not. But to me, there's something extremely interesting about body dysmorphia, how your own brain can trick you into thinking that you're something you're not, and especially going so far with an obsessive trait to where it becomes almost parasitic and addictive in nature. Just gotta watch out for yourself. So if I gotta say anything, love who you are and who you want to be. I appreciate you all so much for watching, and for the love of God, if your surgeon has a TikTok account, don't go to them, is what I would say to that. But anyways, I'm gonna go get some synthol injections into my my abdomen and my arms. So I'll see you next time. Bye, guys.